Question 1. Upon arriving at an adult victim's side, what is the first and most important action a rescuer should take? A. Check for a pulse. B. Open the airway. C. Ensure the scene is safe. D. Call 911 or local emergency number. Answer: C. Ensure the scene is safe. The concept being tested here is scene safety, which is always the absolute priority in any emergency. The keyword first and most important emphasizes that before approaching any victim, a rescuer must confirm the environment poses no threat to themselves or others. Your safety prevents you from becoming a second victim and ensures you can provide effective help. For example, if a person collapses near a spilled chemical, you must secure the area or move the person before beginning care. Always prioritize your personal safety before attempting to help anyone. Question 2. When performing high-quality chest compressions on an adult, what is the recommended depth? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. D. At least 2.4 inches 6 centimeters. Answer: C. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. This question tests your knowledge of high-quality chest compression parameters for adults, specifically the correct depth. The crucial detail is at least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters, because compressing too shallow is ineffective, and compressing too deeply can be harmful. Proper depth ensures enough blood is pumped to vital organs. For example, pushing down about 1/3 the depth of the chest is a good visual guide to achieve this depth. Remember that proper depth, along with a fast rate and full chest recoil, makes compressions effective. Question 3. What is the correct compression to ventilation ratio for a single rescuer performing CPR on an adult? A. 15 compressions to 2 ventilations. B. 30 compressions to 2 ventilations. C. 30 compressions to 5 ventilations. D. 5 compressions to 1 ventilation. Answer: B. 30 compressions to 2 ventilations. This question focuses on the essential compression to ventilation ratio for single rescuer adult CPR. The standard guideline is 30 compressions followed by 2 ventilations, allowing for efficient circulation and oxygen delivery. This ratio ensures that circulation is maintained with minimal interruptions while still providing necessary breaths. For instance, after completing 30 rapid, deep compressions, quickly give 2 breaths and immediately resume compressions. Always strive for minimal interruptions during chest compressions to maximize blood flow. Question 4. After an AED delivers a shock, what is the next immediate step? A. Reassess the victim's pulse. B. Perform another rhythm analysis. C. Immediately resume chest compressions. D. Remove the AED pads. Answer: C. Immediately resume chest compressions. This question addresses the critical post-shock action when using an AED. The phrase "next immediate step" is key, as CPR must be restarted without delay, regardless of the victim's immediate response. Effective chest compressions are vital for circulation after a shock, even if it was successful. For example, if the AED advises a shock and delivers it, you should instantly begin compressions for 2 minutes before the AED reanalyzes. Always remember that immediate, uninterrupted compressions are critical after any AED shock. Question 5. How long should you check for a pulse on an unresponsive victim before starting chest compressions? A. No more than 5 seconds. B. At least 10 seconds, but no more than 20 seconds. C. No more than 10 seconds. D. Until EMS arrives. Answer: C. no more than 10 seconds. This question tests the critical time limit for pulse checks in an emergency. The keyword no more than 10 seconds is vital because delaying compressions to thoroughly check for a pulse can significantly reduce the victim's chances of survival. If you don't feel a pulse within this short window, or are unsure, you should assume no pulse and begin CPR immediately. For instance, quickly feel for a carotid pulse on the neck, and if you don't detect it within about 5 to 10 seconds, start compressions. When in doubt, start compressions. Time is critical for survival. Question 6. What is the recommended rate for chest compressions for adults, children, and infants? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question checks your understanding of the universal compression rate for all age groups in BLS. The correct rate is consistently 100 to 120 compressions per minute, emphasizing the fast component of high-quality CPR. This rate ensures adequate blood flow and is crucial for survival outcomes. You can mentally hum songs like "Stayin' Alive" or "Baby Shark" to maintain this rhythm during compressions. Remember, this rate applies to adults, children, and infants, making it an easy guideline to recall. Question 7. When performing CPR on an infant, what is the recommended depth of chest compressions? A. About 1 inch 2.5 centimeters. B. About 1.5 inches 3.8 centimeters or 1/3 the depth of the chest. C. About 2 inches 5 centimeters or 1/3 the depth of the chest. D. At least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters. Answer: B. About 1.5 inches 3.8 centimeters or 1/3 the depth of the chest. This question specifically tests your knowledge of infant CPR compression depth, which differs from adult and child guidelines. The correct depth is approximately 1.5 inches or about 1/3 the depth of the infant's chest, ensuring effective blood circulation without causing injury. For example, use 2 fingers just below the nipple line to compress the chest gently but firmly to this specific depth. Always remember that infant compressions are shallower than adult compressions to match their smaller body size. Question 8. You are performing CPR on an adult when a second trained rescuer arrives. What should the second rescuer do first? A. Take over compressions immediately. B. Activate EMS if not already done. C. Begin ventilations. D. Find and prepare the AED. Answer: D. Find and prepare the AED. This question focuses on effective team dynamics in a multi-rescuer scenario. While all options are eventually important, the first action for a second rescuer arriving at an ongoing CPR scene is to retrieve and prepare the AED. This allows for rapid defibrillation, which is the most effective treatment for sudden cardiac arrest. For example, while one rescuer continues compressions, the other should be preparing the AED so it's ready to be applied as soon as possible. Integrating the AED quickly is a key element of high-performance CPR teams. Question 9. What is the most common cause of cardiac arrest in children and infants? A. Heart attack. B. Stroke. C. Respiratory arrest, breathing problems. D. Traumatic injury. Answer: C. Respiratory arrest, breathing problems. This question highlights a crucial difference between adult and pediatric cardiac arrest. Unlike adults where heart problems are common, respiratory arrest or breathing problems are the leading cause of cardiac arrest in children and infants. This means that providing effective ventilations is particularly important in pediatric CPR. For example, if a child stops breathing due to choking or a severe asthma attack, their heart will eventually stop if breathing isn't restored. Understanding this difference helps prioritize initial interventions in pediatric emergencies. Question 10. When should you call 911 or your local emergency number if you are the only rescuer and find an unresponsive infant or child? A. Immediately upon finding the victim. B. After 2 minutes, 5 cycles of CPR. C. After you have successfully opened the airway. D. Only if you have a phone with you. Answer: B. After 2 minutes, 5 cycles of CPR. This question addresses the call first versus care first principle for a single rescuer with an infant or child. The keyword only rescuer is crucial here. For infants and children, if cardiac arrest is likely due to respiratory issues, which it often is, providing 2 minutes, 5 cycles of CPR first is recommended before activating EMS. This is because early CPR and ventilation are often life-saving for children. For example, if you find an unresponsive child, start CPR immediately, and then after about 5 cycles, take a moment to call for help. Prioritizing early CPR for children can significantly improve their outcome. Question 11. During CPR, why is it important to allow full chest recoil after each compression? A. To prevent rib fractures. B. To allow the heart to fully refill with blood. C. To avoid overcompressing the chest. D. To make the compressions less tiring for the rescuer. Answer: B. To allow the heart to fully refill with blood. This question tests a critical component of high-quality chest compressions: full chest recoil. Allowing the heart to fully refill with blood after each compression is essential because it maximizes blood flow back into the heart, ensuring that the next compression can effectively pump more oxygenated blood to the brain and other vital organs. Failing to allow full recoil reduces the effectiveness of compressions, much like partially squeezing a sponge. Always lift your hands slightly to allow the chest to return to its normal position after each push. Question 12. If a conscious adult is choking and cannot speak, cough, or breathe, what is the first action you should take? A. Begin chest compressions. B. Deliver 5 back blows. C. Perform abdominal thrusts, Heimlich maneuver. D. Sweep the mouth for any foreign object. Answer: C. Perform abdominal thrusts, Heimlich maneuver. This question evaluates your knowledge of managing a conscious choking adult. The key phrase, cannot speak, cough, or breathe indicates severe airway obstruction, requiring immediate intervention. For a conscious adult, the first line of action is abdominal thrusts, Heimlich maneuver, to dislodge the foreign object. For example, if an adult at dinner suddenly clutches their throat and cannot make a sound, immediately stand behind them and begin abdominal thrusts. Remember that these thrusts are aimed at pushing air out of the lungs to expel the object. Question 13. When administering ventilations with a bag mask device, how do you know if you are providing effective breaths? A. You can hear air escaping from the mask. B. The victim's chest visibly rises. C. The victim's skin color immediately improves. D. The bag fully deflates with each squeeze. Answer: B. The victim's chest visibly rises. This question assesses how to ensure effective ventilations, specifically with a bag mask device. The most reliable indicator of an effective breath is when the victim's chest visibly rises, confirming that air is entering the lungs. If the chest doesn't rise, the airway might not be open or the mask seal is poor. For instance, after positioning the mask and squeezing the bag, watch the chest. A slight, noticeable rise confirms a good breath. Aim for gentle breaths, just enough to see chest rise, to avoid overventilation. Question 14. What is the recommended compression to ventilation ratio for 2 rescuers performing CPR on an infant? A. 30 compressions to 2 ventilations. B. 15 compressions to 2 ventilations. C. 5 compressions to 1 ventilation. D. 10 compressions to 1 ventilation. Answer: B. 15 compressions to 2 ventilations. This question tests a specific detail for two rescuer infant CPR, which differs from single rescuer adult/child ratios. For two rescuers on an infant, the ratio changes to 15 compressions to 2 ventilations to provide more frequent ventilations, reflecting that respiratory issues are often the primary cause of cardiac arrest in infants. For example, one rescuer performs 15 compressions while the other prepares to give 2 breaths. This coordinated effort ensures continuous, high-quality CPR tailored to infant needs. Question 15. If an AED advises no shock advised, what should the rescuer do next? A. Remove the AED pads and wait for EMS. B. Check the victim's pulse and breathing. C. Immediately resume chest compressions. D. Deliver manual compressions to the chest while the AED reanalyzes. Answer: C. Immediately resume chest compressions. This question covers a critical scenario during AED use. When the AED says no shock advised, it means the victim's heart rhythm is not shockable, but they are still in cardiac arrest. Therefore, the next action is to immediately resume chest compressions without any delay. For instance, if the AED speaks these words, "Do not hesitate," instantly continue CPR starting with compressions for another 2 minutes. Always follow AED prompts, but if no shock is advised, high-quality CPR remains the priority. Question 16. What is the appropriate hand placement for chest compressions on an adult? A. On the lower half of the breastbone, sternum, centered between the nipples. B. On the upper half of the breastbone, sternum. C. Directly over the xiphoid process, bottom tip of the breastbone. D. Anywhere on the chest as long as you push hard. Answer: A. On the lower half of the breastbone, sternum, centered between the nipples. This question targets the precise hand placement for effective adult chest compressions. The correct placement is on the lower half of the breastbone, sternum, centered between the nipples, which ensures compressions are delivered directly over the heart. Incorrect placement can lead to ineffective compressions or potential injury to other organs. For example, placing the heel of one hand in the center of the chest, then placing the other hand on top, helps ensure you're in the right spot. Proper hand placement ensures optimal blood flow and minimizes the risk of injury. Question 17. What is the minimum number of cycles of CPR that should be performed before switching rescuers to prevent fatigue? A. 2 cycles. B. 3 cycles. C. 4 cycles. D. 5 cycles, approximately 2 minutes. Answer: D. 5 cycles, approximately 2 minutes. This question addresses rescuer fatigue and its impact on CPR quality in a team setting. The recommended guideline is to switch rescuers approximately every 5 cycles, approximately 2 minutes, of CPR. This rotation helps prevent rescuer fatigue, ensuring that compressions remain high quality, deep and fast. For example, if 2 rescuers are performing CPR, they should plan to switch roles every 2 minutes, or after about 5 complete cycles of 30 compressions and 2 breaths. Regular switching is key to maintaining high-quality compressions during prolonged CPR. Question 18. What action should you take if a conscious infant is choking and suddenly becomes unresponsive? A. Continue giving back blows. B. Begin abdominal thrusts. C. Immediately begin CPR, starting with chest compressions. D. Check for a pulse and then call 911. Answer: C. Immediately begin CPR, starting with chest compressions. This question describes a critical transition in infant choking management. If a conscious choking infant becomes unresponsive, it signifies a complete airway obstruction and likely cardiac arrest, so you must immediately begin CPR, starting with chest compressions. Do not continue choking maneuvers. CPR compressions themselves can help dislodge the object. For instance, if you are giving back blows and chest thrusts to a choking infant and they suddenly go limp, lay them down and start CPR immediately, looking for the object before attempting breaths. When an infant becomes unresponsive from choking, CPR is the priority. Question 19. You are about to use an AED on a victim who is lying in a puddle of water. What should you do first? A. Apply the AED pads directly to the wet skin. B. Dry the victim's chest and the area where the pads will be placed. C. Move the victim to a dry area if possible. D. Skip using the AED and continue chest compressions only. Answer: C. Move the victim to a dry area if possible. This question tests your awareness of AED safety precautions, specifically concerning water. The presence of a puddle of water creates a significant electrical hazard for both the victim and rescuer. Therefore, the first action is to move the victim to a dry area if possible before operating the AED. If moving is not possible, at least ensure the chest is dry. For example, if a person collapses near a pool, pull them completely out of the water before attempting to use the AED. Electrical current and water are a dangerous combination, so prioritize safety before defibrillation. Question 20. What is the main reason for providing early defibrillation with an AED for victims of sudden cardiac arrest? A. To restart the heart immediately. B. To stop the abnormal electrical activity, arrhythmia, and allow the heart's natural pacemaker to resume a normal rhythm. C. To provide blood flow to the brain. D. To assess the victim's cardiac rhythm. Answer: B. To stop the abnormal electrical activity, arrhythmia, and allow the heart's natural pacemaker to resume a normal rhythm. This question delves into the fundamental purpose of defibrillation. The primary reason for early AED use is to stop the abnormal electrical activity, arrhythmia, and allow the heart's natural pacemaker to resume a normal rhythm, specifically in cases of ventricular fibrillation. An AED doesn't restart a stopped heart, it shocks a chaotically quivering heart into resetting. For example, imagine a tangled ball of yarn being untangled by a quick, firm shake. Rapid defibrillation is crucial for improving survival chances when this specific arrhythmia is present. Question 21. When opening the airway of an unresponsive victim who might have a neck or head injury, what technique should be used? A. Head tilt chin lift. B. Jaw thrust maneuver. C. No specific technique, just lift the chin. D. Position them on their side. Answer: B. Jaw thrust maneuver. This question addresses a critical consideration when opening an airway: potential spinal injury. The keyword "might have a neck or head injury" dictates using the jaw thrust maneuver instead of the standard head tilt chin lift. The jaw thrust technique opens the airway without moving the neck, minimizing the risk of further spinal damage. For example, if you find an unresponsive person after a car accident, use the jaw thrust to open their airway cautiously. Always prioritize protecting the spine if an injury is suspected. Question 22. What is the maximum time you should interrupt chest compressions for any reason, including ventilations or AED application? A. No more than 5 seconds. B. No more than 10 seconds. C. No more than 15 seconds. D. No more than 20 seconds. Answer: B. No more than 10 seconds. This question highlights a crucial aspect of high-quality CPR: minimizing interruptions. The guideline states that chest compressions should be interrupted for no more than 10 seconds for any reason, including giving breaths or preparing the AED. Longer interruptions severely reduce the effectiveness of CPR by decreasing blood flow to vital organs. For example, when pausing for breaths, deliver them quickly and immediately resume compressions. Remember, continuous, uninterrupted compressions are vital for maximizing blood circulation to the brain and heart. Question 23. You find an unresponsive adult who is not breathing normally but has a definite pulse. What is your immediate next action? A. Begin chest compressions. B. Deliver rescue breaths, 1 breath every 5 to 6 seconds. C. Go call 911 immediately. D. Wait to see if they start breathing on their own. Answer: B. Deliver rescue breaths, 1 breath every 5 to 6 seconds. This question describes a scenario of respiratory arrest with a present pulse. The key is that the victim has a definite pulse but is not breathing normally. In this situation, the immediate action is to deliver rescue breaths, 1 breath every 5 to 6 seconds, as the heart is still beating, but oxygen is urgently needed. Beginning chest compressions is incorrect because there is still a pulse. For example, if someone collapses and you feel a strong pulse but they are only gasping occasionally, start providing 1 breath every 5 to 6 seconds. Providing rescue breaths keeps the brain and heart oxygenated while waiting for professional help. Question 24. What is the proper technique for opening the airway of an adult victim if you suspect no spinal injury? A. Jaw thrust maneuver. B. Head tilt chin lift. C. Place them in the recovery position. D. Just sweep the mouth for obstructions. Answer: B. Head tilt chin lift. This question tests the standard and most common method for opening an airway when no spinal injury is suspected. The head tilt chin lift maneuver is the correct and most effective technique for an adult victim in this scenario. This maneuver lifts the tongue away from the back of the throat, clearing the airway. For example, gently tilt the head back while lifting the chin to open the airway before giving breaths. This simple yet effective technique is fundamental to BLS. Question 25. You are performing CPR on an adult when the victim vomits. What should you do? A. Stop CPR and wait for EMS. B. Immediately turn the victim to their side, clear the airway, and then resume CPR. C. Continue CPR, ignoring the vomit. D. Deliver a shock with the AED immediately. Answer: B. Immediately turn the victim to their side, clear the airway, and then resume CPR. This question presents a challenging but realistic scenario during CPR. If a victim vomits, the priority is to protect the airway and prevent aspiration. You must immediately turn the victim to their side, clear the airway, and then resume CPR as quickly as possible. Stopping CPR entirely is not an option unless you are physically unable to continue. For example, if stomach contents appear, quickly roll the person, wipe the mouth clean with a gloved hand or cloth, and then roll them back to resume compressions and ventilations. Airway management and minimizing interruptions remain paramount, even in messy situations.